Amazing. Hello, everyone. Thank you so much for joining. I think we're going to get started. My name is Ava Pallotta. I am a sophomore at Harvard University, currently studying government and sociology. I'm also a proud youth advocate. I'm currently organizing with a group called Voters of Tomorrow, but I've also conducted past and hopefully future research on the opioid epidemic and how socioeconomic justice is impacted by drug policy on the local and national level. It's a real honor to moderate the panel here today and to introduce our fantastic speakers, Madeline Hilliard and Emanuel Sferios. I would love to just chat a little bit about what National Fentanyl Awareness Day is before we kick off introducing our speakers and getting into some questions. So as you might already know, today is National Fentanyl Awareness Day, the second ever activation to spread awareness and information about fentanyl. This session is the second session in a 5-part series today, covering an array of topics and perspectives related to the illicit fentanyl crisis. And we're excited to kick off today by talking about fentanyl in party drugs like cocaine and MDMA, and strategies that you can use to keep yourself and your friends safe. We are deeply grateful for the day's 700 plus organizational partners that have signed on to spread the word, and for the team of experts who have lent their knowledge and time to make this day possible. Without them, we couldn't do this important work, and we urge you to attend as many sessions today as you can. Now, just to speak a little bit about our fabulous speakers, Emanuel Sferios is the founder of Dance Safe, a national nonprofit offering peer-based drug education and harm reduction services to youth in the electronic music and festival communities. In 2016, he commissioned the first ever laboratory study assessing fentanyl test strips for harm reduction purposes. More recently, he helped develop a new, improved fentanyl test strip with higher specificity to fentanyl and its analogs that does not produce false positives at optimal drug checking concentrations. Today, he manages Dance Safe's FTS program, which currently distributes more than 500,000 strips a month to state and municipal public health agencies, hospitals, and syringe exchanges, as well as directly to drug consumers. He also acts as an advisor and consultant in drug checking for the immunosity test strip industry and for the drug testing industry in general. And then just to speak a little bit about Madeline, having firsthand seen the heartbreaking impact of numerous deaths to drug overdose tear through her campus, Madeline believed that these repeated tragedies should be prevented. She then went on to repurpose her education in neuropharmacology and hypothesized that if individual users had a non-judgmental resource to help them understand the effect of the drugs they were consuming and methods to mitigate these risks, well-informed users would be safer users. With the help of her colleagues in neuroscience and emergency medical services, she created a system called the Team Awareness Combating Overdose that consistently provides data-backed information about recreational drug behavior and overdose response to help make her community well-informed and make safer decisions surrounding recreational drug use. She also holds a BS in computational neuroscience and is a nationally registered emergency medical technician. Just a little bit about our fantastic panelists, and now I just like to go into a few logistical notes before we get started with our questions. The chat is turned off. There is a space at the end of this discussion to answer some questions, and all questions should be directed to the Q&A feature found at the bottom of the screen. We're hoping to answer as many of your questions as possible towards the end of the session. Also, this session will be recorded and made available for later viewing. Amazing. And so now just to kind of get into the conversation we're so excited to have today, I'd like to kick off by asking you both what is harm reduction and how you define that and how you got involved in this work. Thank you so much. I think we'll kick it off with Emanuel.
Oh, well, thank you. That was a great introduction, Ava. Just answering that question, harm reduction is a set of principles and practices that acknowledges drug use is a permanent part of our society, no matter how much we may want people not to use drugs. Humans have altered their consciousness with drugs for millennia, and it's going to continue. And so we want to meet people where they're at with non-judgmental health and safety information to literally help them use drugs as safely as possible and until they choose to stop using, keeping people alive. Madeline, are we going answering each and then?
Yeah, I mean, that was a wonderful introduction to harm reduction, Emanuel. And of course, Ava touched a bit on how I got involved in this work. And like Emanuel said, it really is meeting people where they're at. We can't stop everyone from using drugs. Like Emanuel mentioned, it's impossible. Humans have always used drugs to alter their consciousness. However, why we're all here today is to prevent people from dying due to drug use. And with illicit fentanyl contaminating more and more drugs, we can all be here today to learn how to prevent those overdoses before they happen and respond to an overdose to help save someone's life if an overdose does occur.
I forgot you also asked how we got started. So in the mid-90s, I began as a needle exchange volunteer in Berkeley. And then when I discovered that people were dying from counterfeit ecstasy tablets at raves, and that the Dutch government had a program, they were also the first ones in the late 80s, believe it or not, to start needle exchange programs. The Netherlands have always been far ahead of the rest of the world in implementing harm reduction programs. And they had a program where people could bring in their ecstasy tablets to a handful of clinics around the country and have them tested using a simple chemical reagent. When I learned that, I just said, wow, like I'm going to do that here. I'd never been to a rave, but that's where people were using ecstasy. So I started Dance Safe, and the rest is history.
Incredible. Thank you both so much. So now specifically talking about young people who might be in our audience today, what do young people need to know about the current drug landscape, and why do you believe that this conversation needs to happen now?
Madeline, do you want to go first?
Yeah, so it's something, I was a college student not too long ago. I graduated 2 years ago from USC, and illicit drugs are something that, people use. Everyone's familiar with alcohol that's legalized and regulated, and so we're able to have a safe supply of that. We don't have that when it comes to illicit party drugs like pills or MDMA or cocaine, anything of that nature. And with the current drug landscape, any of those drugs can be contaminated with illicit fentanyl. Now, it's important to make the distinction. I want to start out by talking about how there are really two kind of types of fentanyl. There's many fentanyl analogs, but we're breaking it down today into illicit fentanyl versus medical fentanyl. I work in the emergency department here in Los Angeles and want to let everyone know that fentanyl is a drug that is used medically safely all the time. Everyone from paramedics to doctors administer fentanyl to patients for pain or for anesthesia on the level of about 25 to 100 micrograms at a time. What we're here to talk about today is illicit fentanyl. That is fentanyl that is not produced by pharmaceutical companies. It's not regulated, and that is what is contaminating these illicit drugs. So just to start off the conversation by letting everyone know that if you are in a medical setting and someone is going to administer fentanyl to you, that's not something you need to be concerned about. It's something that we do all the time. And because you're remaining under medical supervision, let's say anything did go wrong or you had an adverse reaction to the fentanyl that you were being provided by a licensed medical physician, we would be able to mitigate that. We would provide you Narcan on site. And so that's not something to be concerned about. What we are here to talk about today, and what is a great concern, is illicit fentanyl.
Yeah, and illicit fentanyl is the cause directly of the 5-6-fold increase in drug-related fatalities since about 2015-ish, when it began replacing heroin on the illicit opioid market. And this really is a result of what's often called the iron law of prohibition. When a certain class of drugs is prohibited, the strongest version of that becomes dominant eventually. So during alcohol prohibition, you couldn't find beer and wine. It was all hard liquor. And it's really because you can transport it and smuggle it in a small amount of space. And given that fentanyl is 50 times more potent than heroin, and some of the analogs like carfentanil, even more potent than that, you can smuggle it more easily. You also don't have to grow poppy fields in order to extract the opium and make the heroin. So it's become dominant, pretty much taken over the illicit opioid market. Now, why it's entering party drugs is a theory a lot of people speculate on. Certainly, much of it is contamination. And some of it might be intentional, whether an effort to hook a user, or even domestic terrorism is a theory that's been thrown around there. Either way, we do know that fentanyl is in cocaine, it is in methamphetamine, which some people may not consider a party drug. It has cropped up rarely, but it has in MDMA and ketamine. And even though the fatalities are extremely low compared to the number of people dying who are intentionally using fentanyl, because it's the only illicit opioid that's around that they can use, I am sure the majority of people would prefer other opioids if they were available, but it's all pretty much fentanyl now. The vast majority of people who are dying from fentanyl are intentionally using illicit opioids, but there's hundreds of people dying now a year who are accidentally ingesting fentanyl, whether it's in their party drug or let's just say a counterfeit pharmaceutical in a person who is not using those drugs problematically. So this session here is for people who are not intending and not intentionally taking fentanyl. And that could be a recreational user or just someone who might take an occasional Xanax or Percocet to relax, something like that. We're here to talk about how you can protect yourself. And I will be talking about fentanyl testing strips when it's my turn.
Yeah, and just to piggyback off Emanuel there a little bit, to clarify, again, we are speaking about accidental fentanyl consumption where users did not intend to consume fentanyl and how we can help avoid that. It is in my work primarily with college students. It is something we see quite frequently. There have been overdoses that our organization has helped to reverse, caused by fentanyl contaminating cocaine and other party drugs. The other one to be very aware of is counterfeit pharmaceutical pills. As Emanuel will get into, it's something that everyone should know that if the drug did not come from your pharmacy, you need to be testing it for fentanyl. When it comes to these counterfeit prescription pills, those are the most likely to have fentanyl contamination because, as Emanuel touched on, fentanyl is synthetic, which means it's much cheaper to produce and much stronger. So drug manufacturers can combine a little bit of fentanyl with filler powder and press it into what looks like an Oxycontin, what looks like a Xanax. There's even been instances of what looks like Adderall that actually contains fentanyl. And that's what we want users to be testing their drugs for. And Emanuel, the test strip king himself, is going to be giving us a wonderful demonstration on how to use test strips properly. It's something that's super easy to do. It only takes a couple of minutes, but it really can save your life.
Thank you so much. And thank you for your wonderful description of Emanuel as the test strip king. I'm definitely going to be stealing that one. But yes, thank you so much both for your explanation about the difference between medical and illicit fentanyl and also its presence in the street drug supply. And then next, I would love for you both to talk about, maybe kicking it off with you, Emanuel, talking about the danger of fentanyl across different drug types, where it's commonly found, and if there's anything that fentanyl is not in yet.
Well, according to my research and others that I collaborate with online who are drug checking programs around the country, outside of down or illicit opioids, fentanyl is most often seen in counterfeit pharmaceutical pills, like Madeline said, and then I would say cocaine and methamphetamine. It actually has not been found, to my knowledge, in counterfeit Adderall. Counterfeit Adderall contains methamphetamine. There was one pill that was discovered that had trace amounts of it, but that in a fake Adderall, meth-containing fake Adderall with a little bit of fentanyl, but that could have been, most likely that was contamination from being in the same baggie. So at this time, we're not recommending that people need to test Adderall for fentanyl, and we don't want to generate alarm until we start seeing it happen on a kind of a regular basis. Same thing for cannabis. We're not seeing fentanyl in cannabis, nor would the test strips be able to test cannabis for fentanyl. Those rumors probably result from well-meaning anti-drug messaging, wanting young people not to smoke cannabis. So people saying, oh, there might be fentanyl in it. And also people who get urine tested and fentanyl is discovered in their urine. And then they claim, oh, I don't do anything but smoke cannabis. It must have been in the cannabis, when really they probably were consuming something else. So no real need to test your cannabis for fentanyl right now. And that includes store-bought vape pens. Unless we start seeing fentanyl vape pens out there, which has always been a big concern of mine. We're not really seeing that yet. And then they're getting mixed up. We're not seeing fentanyl added in. But it's always best to purchase any cannabis product from a licensed dispensary, no matter where you get it from. So, yeah. Thank you.
And that is consistent with what we see in the emergency department. We do have accidental fentanyl overdoses come in almost every shift that I'm on, unfortunately. But the good news is once someone gets to the emergency department, they do survive. So we'll go over a little bit later how we can ensure that that happens. But we do see it most commonly in the emergency department due to counterfeit pills or contamination in heroin, methamphetamine, or cocaine. I personally have not seen a case of fentanyl contamination causing an overdose with MDMA, although, like Emanuel said, that can happen, although it is extremely rare. And I myself have never seen an instance of fentanyl contamination in cannabis of any kind leading to an overdose where someone presented to the emergency department afterward.
Thank you both so much. And now just to kind of shift into the next part of our conversation, I'm really excited to get started talking about harm reduction and all the different smaller conversations that entails. So to kick it off, I would love if Emanuel, the test strip king, could kick us off by talking about what test strips are and how they're used. And also if you could jump into that chocolate chip cookie effect and what that means.
Yeah, sure. So fentanyl testing strips are a type of immunoassay test strip. And that just means that it uses an antibody that is coded for fentanyl, and similarly to a pregnancy test, where it will either create a red line or not create a red line in the presence of fentanyl. And in this case, you're looking for the absence of that red line. So here is a fentanyl test strip. And essentially, you will dissolve a little bit of your drugs in water and dip the strip in, and you'll actually see the water travel up the strip. And then there's two lines that appear, hopefully, a test line and a control line. The control line is just telling you that the strip is working. And if the test line appears, that means there is no fentanyl in the sample. If the test line does not appear, if you only get one line, that's a positive test for fentanyl. But it's not that simple, because it's very important to prepare your sample correctly. No immunoassay test strip is infinitely sensitive to the drug it's coded for. So you can't just sprinkle a little bit of powder in a cup of water and dip the strip in. It's going to be potentially way too dilute, and you will miss the fentanyl. So determining the proper dilution for drug checking for any immunoassay test strip that you're using requires laboratory studies. It requires mathematics, knowledge of how much fentanyl is typically found in each different illicit drug. The lab tests not only need to look at the sensitivity for fentanyl and its analogs, but it needs to check the sensitivity for any potential false positives as well. And what we found with the previous strips, the blue strips, ours are yellow. The ones that had been used for the first 5 years since the fentanyl crisis began, is that they did produce false positives at optimum drug checking concentrations. That's the concentration that is best able to detect fentanyl in the drugs you're checking. And that concentration is about 10 milligrams per milliliter of water, or 50 milligrams of your powder drug into a teaspoon of water. That's fairly concentrated, but when you're testing party drugs for the presence of fentanyl, you want it to be fairly concentrated, especially because it appears to be contamination that's causing the problem. And when your baggie of powder is contaminated with fentanyl, the fentanyl might be over in one side of the baggie. So preparing your sample, and there could be a fatal dose over there sitting in that little corner of the baggie, right? So if you just test something from the other side and there's no fentanyl in it, and you think you're good to go, you could consume powder from the other side and die. And so you need to homogenize your drugs first. And so the instructions require crushing and mixing as thoroughly as possible your powder. Let me go back up. This is unless you're going to test everything you intend to consume. That is also a possibility. And that's the recommended dose. You take the entire bag, the 8 ball of cocaine, either the dose you're about to consume, like say you're taking 125 milligrams of MDMA, a very common therapeutic and recreational dose. You put the whole dose, and when you're testing the whole dose, we could recommend just using a 1/4 cup of water, because if there's an appreciable amount of fentanyl in there, that won't be too dilute. And then you can drink it because the strip does not contaminate the water. But if you're wanting to, test an entire 8 ball of cocaine, you don't want to test every time you snort a line. You could dilute the whole thing and then evaporate everything in an oven, and that process takes a while, but people do that. But because most people don't want to take the time and don't use the best practices, we have a backup method, which is the one that most people use, and that is testing a portion of your drug. So that's what I began explaining here. If you're only going to test a portion of your drugs, you first need to homogenize the material really well to distribute any fentanyl that might be clumped up in the corner. This is what we call the chocolate chip cookie effect. It's not as important if you're testing illicit opioids, because that's predominantly fentanyl and it's mixed somewhat evenly. But that's rarely the case when you're testing cocaine or meth or MDMA or ketamine. Mostly it's contamination. And so you need to mix it thoroughly. And then we recommend testing at least 50 milligrams. Again, even if you like snorting your drugs, you can still drink the liquid. You're gonna feel it, so you're not wasting. There's no reason not to do it. The effects of the drug will come on a little slower, but it'll last a little longer too. Your life is more important than the rush you might get from snorting. So 50 milligrams is not a lot to waste, and you put that in a teaspoon of water, and that's 10 milligrams per milliliter, because a teaspoon is 5 milliliters. And you hope you get a red line. Even a very faint red line is negative. It's something a lot of people get worried about. That test line can be pretty faint, but if you can see it at all, that's a negative result for the presence of fentanyl. If there's no red line and you've used the proper dilution, then that's positive for fentanyl. I could probably talk more of it. Maybe Madeline wants to say something else, or there's questions, or that's generally how to use. If you're testing a counterfeit pharmaceutical pill, I should go into that right now. We recommend testing the entire pill. And again, just like you're testing an ecstasy tablet or your entire dose of MDMA, you can just use a 1/4 cup of water and put your entire dose in there. Because you're not trying to pick up the tiniest amount. If there's any appreciable amount of fentanyl inside of a counterfeit pharmaceutical pill, a 1/4 cup of water is going to be way concentrated enough that you're going to be able to detect it.
Thank you so much, Emanuel. I just wanted to ask just also about the potential for false positives, and if there's any chance of that happening with test strips.
Yeah, so with our new improved strips, we did laboratory studies at the University of California at San Francisco, as well as University of Notre Dame. and found no false positives with any drug that we tested at the optimum drug checking concentration of 10 milligrams per milliliter. You can actually double that too and not get a false positive, but you get too much higher than that, anything will give a false positive. If you super saturate a substance in the liquid, it will produce a false positive. The only drug that does, with all fentanyl strips on the market, even at very low concentrations, is diphenhydramine. But diphenhydramine is not typically found in party drugs. It's usually only found in illicit opioids, which does complicate the testing of illicit opioids. But the previous strips that we were using did give false positives with meth, MDMA, as well as two common cuts in cocaine, lidocaine and levamisole. And so we had two sets of instructions for the previous strips where you had to dilute 5 times as much. Now, this would risk missing some of the fentanyl analogs, which require a little bit of a higher concentration in order to detect. But nonetheless, we thought it was reasonable back in 2017 when we first started distributing and advocating for these strips that they worked well enough that we decided to start distributing them. Then a couple of years ago, lots started coming out that were performing differently and producing false positives even at lower concentrations. And subsequently, multiple university lab studies determined that those older strips were being manufactured inconsistently, lot to lot. And we felt lucky that we got in contact with a different manufacturer and had already begun testing their strips and determined that they did not produce false positives. And they also produced their own, this company produces their own antibody and their own test strips 100% in-house, which is one of the few companies in the world who does that. A lot of the other manufacturers will buy antibodies from different antibody manufacturers, and a lot of distributors will buy strips from different manufacturers and have them branded to look the same. And so there's really no way of knowing whether lot to lot the strip that you're purchasing is going to be the same and work the same as the lab studies that were done originally. But we, DanceSafe, got a contract with the manufacturer to guarantee lot to lot consistency in writing. They're going to use the same antibody and they're not going to purchase antibodies from different antibody producers. It's their antibody, which means the sensitivity and selectivity profile is going to match. And they're also going to do, they do lot verification testing prior to distributing them to us. So that's why we recommend, buy the DanceSafe strips, look for the yellow strip, especially if you're testing party drugs like meth, MDMA, and cocaine, the very 3 drugs that the other strips produce false positives with.
Thanks so much for explaining that, Emanuel. And just one thing I want to point out, just to kind of get everyone imagining the right thing. When it comes to the fentanyl test strips, the lateral flow immunoassay strips, it sounds very fancy. It's the exact same technology that is used for your at-home COVID tests, pregnancy tests, things like that. And so, like Emanuel mentioned, the negative result you want to see has 2 red lines. One line is going to be much darker than the other in most cases, but like he said, that second line, as long as you can see it, that is a negative test result. If you can only see one line, that is a positive result for fentanyl.
And I'd like to draw your attention to the now quite popular microscoop. So we came up with this idea after getting a lot of feedback from social service agencies, health departments who were distributing strips to unhoused folks who did not have milligram scales. And then, of course, it dawned on us, like even most college students at home or in their dorms don't own a milligram scale, or maybe it's too expensive. And so how do you measure 50 milligrams of your powder? Well, we found these microscoops, and one perfectly level scoop of all the drugs we tested was right on the money, between 9 and 11 milligrams. And so 5 of these scoops into a teaspoon of water is exactly what you need. And these are reusable, and they're less than $1 on the DanceSafe website. And then we also realized that I don't have a bottle cap on me because I don't drink soda, but there's like an image of a bottle cap, like a regular bottle cap from a 20-ounce Coca-Cola or Mountain Dew. Even the 2-liter uses the same standard size cap. Well, that plastic bottle cap holds just over a teaspoon of water. So if you fill that almost to the top, you don't want to fill it all the way to the top anyway, because then when you stir it, it's going to overflow, right? So it's really the perfect tool to measure out a teaspoon of water. 5 microscoops into a teaspoon of water, and you have your perfect dilution to test your powdered party drugs.
And those test strips are wonderfully easy to use, as Emanuel has said, with resources you have available on hand. And if you need access to those fentanyl test strips, of course, you can get them from the DanceSafe website. If you are a college student, you can also get them for free through Team Awareness Combating Overdose, TACO, our nonprofit. You can find DanceSafe's fentanyl test strips available to you for free at 22 college campuses across the country, and more being added every month. So check out our website if you are a college student and want to get free access to fentanyl test strips for yourself and to keep your friends safe.
Amazing. Thank you both so much for such a comprehensive overview about test strips. Next, I would love to talk about recognizing and responding to an overdose, what symptoms look like, what to do in that situation, and also if an overdose can happen from touching fentanyl. I'm very curious about that as well. And Madeline, I would love to turn it over to you to speak about that.
Be more than happy to, Ava. So I'm going to put up on the screen here just a couple of graphics so we can all follow along together. But one thing I do want to highlight just at the beginning is that it is clinically impossible to overdose by touching fentanyl. Fentanyl cannot absorb through your skin and be able to cause an overdose just from touching it. You may have heard that there are fentanyl skin patches. Those are actually patented designs because they had to clinically develop those patches to be able to get fentanyl through the skin. It's not something that you can overdose from just by touching it. Similarly, if you are supporting someone like we're going to go over who is experiencing a fentanyl overdose, you are not going to yourself overdose by interacting with them and trying to provide them aid. So I just want to set that out at the beginning. As a medical professional, I would like everyone to know it is not possible to overdose from fentanyl by touching it. So now that we've gotten that out of the way, I'm going to go over the big 3 signs of a fentanyl overdose. I want everyone to walk away from today remembering these big 3 signs really well, because these are the things that you're going to be looking for if you think someone potentially is overdosing. So the first one that I want to talk about is unconsciousness. So that's going to be kind of like your first warning sign. You see somebody, they are passed out. How do you know if they're passed out from an overdose, or maybe they've just had too much to drink, or they're just sleeping? Well, first you're going to try to talk to them. You're going to say, "Hey, Ava." And if Ava doesn't respond to that, then that's verbal stimuli. We're going to move on to painful stimuli. So there are 2 ways you can do this. The first one is a trap pinch, and I want everyone in the audience to kind of do it to yourself with me. You're going to pinch the trapezius muscle. So that's the corner right here in between your neck and your shoulder. You're going to go to that person and you're going to pinch them right there as hard as you can. If you kind of practice that on yourself, you can feel it's pretty painful even if you don't do it too hard. If you give that as hard as you possibly can, that for someone who is intoxicated from alcohol or just sleeping, that's going to wake them up. They're probably not going to be very happy with you. But for someone that's overdosing on an opioid like fentanyl, fentanyl is a painkiller. They are not going to be able to feel that painful stimuli. If you really want to double check, there's the trap pinch. Another way that we cause painful stimuli in EMS is the sternal rub. So you take your knuckles and you rub it up and down hard on the person's sternum. That is another technique you can use. However, we have transitioned away from that over to the trap pinch because let's say someone wasn't actually overdosing, they were asleep, they were intoxicated. Some people feel like they're being sexually assaulted because of where you're touching them in that instance. So best practice is to do the trap pinch as hard as you can. But if you do that trap pinch or the sternal rub and the person does not respond to either of those, they are unconscious. The next thing you've confirmed that now. You want to make sure that they are breathing. Someone that's overdosing on fentanyl is going to be breathing either very slowly or not at all. Why? Because fentanyl, when it is active at very high levels, it causes so much relaxation in the body that it relaxes your diaphragm, the muscle that pushes air in and out of your lungs. So with that muscle so relaxed and not really working, that person's not going to be breathing. So that's how fentanyl can kill them. That's also one of the second things we want to check for. Just looking at someone, you can't really tell if they're breathing or not. We're on Zoom. I can't tell if anyone that I'm looking at right now is breathing just by looking at them. So what you're going to want to do is just take your hand and place it on their chest, feel for the rise and fall of their breath. If you can't feel that, or it's very slowly, the average person breathes about once every 5 seconds, or 12 to 15 times a minute. That person is only breathing maybe 6 to 8 times or less per minute, or once every 10 seconds or more. That is very slow breathing. The other way you can check is by holding your hand under their nose and over their mouth, not directly on them, just holding it there to feel for the warm breath. That person is breathing very slowly or not at all. That's the second major sign you're going to check for. At that point, it's a medical emergency, regardless of why they're not breathing. You're going to need to call 911 at that point. And I'll get into calling 911 and Good Samaritan law in just a second. But the third major sign of a fentanyl overdose, the person's going to be unconscious, going to be breathing very slowly or not at all. And then the third is they're going to have pinpoint pupils. That is the telltale sign of an opioid overdose. Similarly to relaxing your diaphragm and causing the person to stop breathing, fentanyl causes the little muscles in your eye that expand and contract your pupils to totally relax. So they get super tiny and they won't respond to light. So all you need to check for this is a flashlight. You can use your smartphone. You're going to turn on your flashlight. And the person's going to be unconscious. So their eyes are going to be shut. What you're going to do is you're going to pop open their eyelid and you're going to shine the flashlight in their eye for 3 to 5 seconds. What you're going to want to watch for is when you move the flashlight away, the person's pupil, the small black part in the middle of their eye, should get bigger. If their pupil size does not change from when the light is on it to when you move it away, that is a pinpoint pupil. That is the telltale sign of an opioid overdose, and you are definitely going to want to administer Narcan at that point. So with those 3 things in mind, I'm going to leave this up on the screen just so it really sears into everyone's brain, because if you're at a music festival, if you're at a party, even if you're walking on the street and you see somebody unconscious, these are the big 3 signs that you want to look for and when you're going to need to engage to start helping to save somebody's life. I want to talk about Good Samaritan law and calling 911 a little bit. Obviously,
Madeline, can I ask a question for you first? Because I think one of the things that people get confused most about is the difference between someone who is unconscious from ketamine versus unconscious from an opioid at festivals. And people have panicked and even administered Narcan when it was not a fentanyl overdose. Can you confirm that the slow breathing and pinpoint pupils do not happen with a ketamine overdose, or people intentionally taking a large dose of ketamine and becoming unresponsive?
Yeah, so like I said, pinpoint pupils are the telltale sign of an opioid overdose. That is going to be the biggest indicator that you need to administer Narcan. Now, in the cases of people mistaking someone who's unconscious from ketamine and administering Narcan, one thing to note is that Narcan is not going to hurt somebody if they're not actually overdosing from fentanyl. So when in doubt, sometimes it's a scary situation and people do get confused, like in the instances Emanuel is mentioning. The best practice is just to administer Narcan if you are confused. However, look for those pinpoint pupils. If you're not seeing that, it's probably not an overdose from an opioid, and Narcan isn't going to help them. It's not going to hurt them, but it's not going to help them. And by not administering that dose that they don't need, you can save your dose of Narcan for someone who actually does need it, because Narcan is a precious resource. It's something that can be costly to access, which I'll talk about a little bit more in a moment. But the telltale sign of an opioid overdose you really want to look for is that pinpoint pupil. When it comes to calling 911, obviously many people have concerns about, I'm in a party situation, and what if I call 911 and the cops show up? So I want to clarify for everyone, as an emergency medical responder who works in EMS, when you dial 911, you are dialing 911 dispatch. So the person on the other end of that phone is the person who decides whether to send you police, fire, ambulance, or a combination of the three. So when you're calling them, the first words out of your mouth are, I am witnessing a medical emergency. That way, that dispatcher knows right away what you need is an ambulance. The next thing you can say is, I think my friend may have overdosed. And then you're going to want to tell that dispatcher whatever it is you know that that person may have consumed. So we were drinking, I saw them consume some cocaine, and now they're not breathing and they have pinpoint pupils. And by giving that dispatcher that extra information about what other drugs might be in that person's system, that allows us as emergency medical responders to be more prepared when we arrive on scene to get your friend back to being stable as soon as possible. Again, so the first words out of our mouth when we're calling 911 is, I am witnessing a medical emergency. I believe my friend may have overdosed. And then you can tell them what you think the person may have taken. This is important because this is what allows someone to get the medical attention they need. And the good news is that in 47 of the 50 states in the United States, there are Good Samaritan laws, which means that if you are calling to receive medical attention in the event of an overdose, even if the cops showed up with those EMS responders, that if they find drugs on your person or on the person of the overdose victim, neither of you can be criminally prosecuted for having amounts of personal drug use on your body. So this is important. I'll make another distinction. That does not cover if you have enough drugs on you to sell. And you will have to look up, like, by your state, how much is considered, because it does vary significantly from state to state. However, like I said, 47 of the 50 states, if you have one extra pill of MDMA or one more gram of cocaine on your person, you should not be concerned about being arrested for calling 911 for an overdose. And the other reason I emphasize very strongly to say medical emergency, as an EMS responder who used to work on ambulances, the only times police would show up to the scene with us is if the scene was dangerous for us as the medical responders. So in cases of an active shooter or in cases of a potentially violent patient. However, if you are at a house party in a safe location, if the first words out of your mouth are medical emergency, it's unlikely that police will be sent with you. However, in the event that they do show up, they are not the people that are going to be treating your friend who overdosed. So the EMS responders on scene, anything you tell us is covered by HIPAA laws. We can't tell anybody else that unless we are subpoenaed to do so. So please tell the emergency medical responders any and all information you have on what drugs the person may have consumed, because that's going to get them treatment and help save their life faster. In that scenario, the police are not going to be the ones treating your friend. There's no medical benefit to telling the police any information at that time. Just hope that that's clarified for everyone. And the 3 states that do not have Good Samaritan law are Kansas, Texas, and Wyoming as of last year. So if you do live in those states, I would encourage you to call your representatives and get Good Samaritan law, because many studies have shown that states that have it, it has helped to reduce rates of overdose deaths. But all of that to say that if you are witnessing an overdose and you are in any other state that is not Kansas, Texas, or Wyoming, please call 911, tell them you're witnessing a medical emergency. Even in those 3 states, I would still encourage you to do so. Just want to be clear that those states do not currently have Good Samaritan laws that would cover you for having amounts of drugs for personal use in your possession at that time. Happy to answer any questions people have there at the end. But now want to get into the best way that anyone can use to save someone's life from an opioid overdose, and that is Narcan. Narcan is a wonderful drug that has been used for years in medical settings, intravenously and intramuscularly. But within the last 10 years, we now have nasal Narcan. So no needles required. It is a nose spray. A dose of Narcan looks like this. Just to give you a little more context, when you get a box of Narcan, and there are other brands of nasal naloxone. So as long as you're getting nasal naloxone, that is the opioid overdose reversal drug that you're looking for. It doesn't have to be the brand name Narcan. But I have Narcan here with me today. This is what a box of Narcan looks like. It comes with 2 doses inside. Each of these are a single-use nose spray. So you get 2 of these, and each of these are good for 1 dose. Once you administer it, then you'll throw it away. It's done. But with that box of Narcan and your 2 doses inside, if you are in the situation where you've seen someone who is unconscious, they are not breathing or breathing very slowly, and they have pinpoint pupils. At that point, you're going to have called 911, and you're going to have first responders on their way because you told them you were witnessing a medical emergency. And at that point, you are ready to administer Narcan. So to do it, it's very simple. You take it out of the package, you have your nose spray, you're going to insert it into the person's nostril, doesn't matter which nostril, press the pink plunger button. Congratulations, you've now administered your first dose of Narcan. You're going to check your phone, check your watch, clock 2 minutes. Within those 2 minutes, the person should respond. And it's really an incredible thing to see. There will be people who are, I've seen, they are blue because they have not been breathing for a couple minutes. And you will literally see them go and begin breathing again. If that happens in the first 2 minutes, congratulations, you've just saved a life. It really is that simple. After 2 minutes, if the person has not responded, they are not opening their eyes, they're still breathing very slowly or not breathing at all, you're going to want to take out your second dose of Narcan out of that package. And again, same process. You take your plunger, put it in whatever other nostril, and press the pink plunger. That's your second dose of Narcan. Again, by that point, for most overdoses, for people who were not intentionally using opioids, 2 doses is usually sufficient. However, if after you've given both doses and 2 minutes after the second dose, if the Narcan has not taken effect, the person is still breathing very slowly or not breathing at all, 2 things may be true. 1, they have taken an extremely high dose of an opioid like fentanyl, and it's not enough Narcan to reverse their overdose. If you have additional Narcan on hand, you can continue administering Narcan to them. Additional doses of Narcan are not going to hurt the person. The second thing that may be true is that it is not, in fact, an overdose from an opioid. So like Emanuel brought up, they were overdosing on ketamine. Narcan is not going to help them, but it's also not going to hurt them. However, something that happens very commonly is overdoses from combining Xanax and alcohol. That can cause respiratory depression. That can also cause slow and no breathing. Narcan is not going to help them. But in that situation, the person isn't breathing well, and they need to get oxygen in order for them to survive. So at that point, you are going to want to start doing rescue breaths. Now, rescue breathing is where you tilt the person's chin back to open their airway, you hold their nose closed, and you breathe into their mouth once every 5 seconds. Again, I want to remind everyone, if the person's overdosing on fentanyl, giving them mouth-to-mouth resuscitation is not going to cause you to overdose on fentanyl. Also, if you are concerned about germs and things like that, now in 2023, there are masks pretty readily available. You can use a COVID mask and poke a hole in the middle to create a barrier for yourself if you are going to give mouth-to-mouth resuscitation and are concerned about that. However, if you've given the Narcan and the person has responded, they're now breathing again, congratulations, you've just saved their life. You're going to want to roll them over onto their left side and put them in what we call the recovery position. So laying on their left side, one hand under their head to support them, and make sure that they're staying laying on their side. We want to do that in the event that the person vomits. So Narcan itself has no negative side effects and no what we call contraindications or reasons why it might be dangerous to administer to someone. None of those effects are true when it comes to Narcan. However, what can happen is when the person is overdosing from an opioid, they're sky high, essentially so high to the extent that they're almost dying. What Narcan is going to do is drop them down to sober very rapidly. That drop in the high can cause some adverse reactions. One of them is nausea. So that's why we want to put them on their left side in the recovery position in case they do vomit. They're on their side. That means that the vomit can fall out of their mouth. If they're laying on their back, they can accidentally choke on it and aspirate, and that does cause deaths. So we want to put them on their left side, so if they do vomit, we can keep their airway open. Some other reactions that can happen when administering Narcan to watch out for people, especially those that are intentionally using opioids, right? They went from sky high to dead sober. You've taken their high away. And so some people can wake up from that, and because they are so rapidly sober, they can respond a bit aggressively. If this happens, remove yourself from the situation. You've already called 911. You already have emergency medical responders on the way. We are trained to deal with potentially violent patients. So remove yourself from the situation, keep yourself safe, and we'll be there within 10 minutes to take over that scenario for you and make sure that that person doesn't hurt anyone and also doesn't hurt themselves. A couple other things is the person may wake up and just be really confused and say, I didn't use drugs and I don't know what's going on. I'm totally fine. That person still needs to go to the hospital. So, right, you've already called EMS. They need to take them to the hospital because Narcan only lasts 30 to 90 minutes. Many opioid drugs can last 6 to 8 hours or more. So what we see frequently in the emergency department is someone has overdosed on an opioid, they've been given Narcan, but then about an hour later, they're sitting in the ER and their breathing starts to slow down again, and they're starting to re-overdose, and we have to give them more Narcan to keep them alive. So that is why, to avoid the person re-overdosing later, anyone that received Narcan, even though they're alive, they do still need to go to the hospital to get medical care. And the last reaction is the person might wake up, say, I'm fine, I want to go back to the party, let's do some more cocaine. Do not let the person consume any other drugs or alcohol. They are barely stable. You just saved their life. Please don't let them put anything else in their system that when they get to the hospital, we're just going to have to undo. It makes it much harder to treat people when there is combined drug use, because some drugs, the antidote to one, can make the other one worse. So those are the things you're going to want to look out for. But if you give someone Narcan, you've saved their life, put them on their left side and wait for EMS to arrive. You've saved their life, and they're going to wake up tomorrow morning, which is the ultimate goal.
Thank you both so much. Madeline, thank you so much for all that very important information. We're now going to move into the Q&A portion of the panel for our remaining few minutes. And I would love, while I am disappointed that we cannot address every question today, it seems that I'm seeing a lot of questions repeated about further questions related to touching fentanyl and what that means. So I was wondering if you two could please address both if the inability to overdose from touching fentanyl also applies if you have any sort of cuts on your skin or in your mouth, and also if that is still true of children. Some people were curious about whether or not children can overdose from touching fentanyl.
Yeah, so happy to take those. Same thing goes for children as for adults. They're not going to overdose from touching fentanyl. I understand why this question may be asked. There was a case in one of the hospitals here in Los Angeles where a toddler got a hold of a fentanyl skin patch and did unfortunately fatally overdose because they were interacting with a fentanyl skin patch. However, children will not overdose from interacting with fentanyl powder just by touching it. In order to overdose, if you have a cut, it's going to have to be a pretty deep cut in order to get enough fentanyl into it for it to get into your bloodstream. Little surface abrasions are also not going to cause a fentanyl overdose just by touching fentanyl.
Thank you so much. Also, just some further questions maybe towards you, Emanuel, about test strips. Are fentanyl strips considered drug paraphernalia? And are there any states that don't allow test strips?
Oh, that's an excellent question. We get this question all the time at DanceSafe. About half the states in the country still have old, outdated paraphernalia laws on the books that define anything used in any way upon a controlled substance as illegal paraphernalia. But in 25 years, there hasn't been a single arrest that we know of anyone for simply possessing a drug checking kit. And I say 25 years because that's how long DanceSafe has been around, shipping kits to every state in the United States. So that's our reagent test kits, which can be used to avoid counterfeit ecstasy tablets and also fentanyl testing strips. So what we tell people who call is that your life is more important than really the zero risk that you're going to get prosecuted for this. Sometimes laws get stale, and indeed, there have been many states over the last few years who have been overturning their paraphernalia laws, not because people are getting arrested, but because those laws are preventing state money from being used to distribute fentanyl test strips. DanceSafe sells strips to 13 state public health departments, dozens of county health departments programs, as well as a couple of hundred syringe exchanges, nonprofits, and other social service agencies. So do not be afraid. You may not be able to buy these strips if you live in certain states from Amazon, because Amazon's lawyers are ultra conservative and they want to abide by the letter of the law, right? But DanceSafe will ship these strips to any state in the country.
Thank you so much. And then just another question more generally about stigma around drug use. Someone noted drug use is often done in secrecy despite the efforts of having open communication. And how can we address the issue of secrecy and harm reduction strategies?
Well, I love this question too, because it's one of the most important reasons that we should, as a society, decriminalize drugs for personal use. We don't have to legally regulate them. That's going to be more difficult, but just making it no longer a crime to possess drugs for personal use opens the public conversation and the public space where people no longer feel afraid to talk to their parents, their teachers, to police, to educators. They no longer fear approaching drug checking services or otherwise hiding their drug use. So if you allow me a little political advocacy there, I think really what we need to do, and some states are moving towards this, we need to decriminalize personal possession of drugs. That's probably the best thing we can do to save lives, because it opens the public space.
But in the meantime, before some of the laws catch up with what might be in the best interest of public safety, one thing that we can all do is remind our friends that if you are going to use any illicit substance, never use alone. Using alone is where deaths occur, because if there was fentanyl in that drug and you did overdose from the fentanyl, there's no one there to witness that. There's no one there to check for the big three signs, call 911 and administer Narcan. Using alone is where deaths occur. So please do not let your friends use alone. And if you yourself are going to use, even if you are physically by yourself and you can't get anyone to sit there next to you, call a friend, have them on the phone, make sure that they're checking on you, make sure that you're checking on your friends. And if there's not a response over that phone line for a couple of minutes, call 911 immediately. The big three things that we always want to remind people when it comes to using drugs and avoiding potential fentanyl overdoses is: number one, never use alone. Number two, test your drugs. Number three, carry Narcan.
Thank you so much. And I think that moves into a fantastic takeaway. I would like to invite either of you to say any final wrap-ups or takeaways you would like our attendees here to have, although Madeline, I know you just hit that in a very major way. So anything else you'd like to add, Emanuel?
Well, whenever I talk, I really love to talk about the need to end the shame and stigma that's associated with using drugs. I think that our drug war culture manifests the very misuse and abuse of drugs that it pretends that it's preventing. When we tell young people that there's no possible way to use any illegal drug safely or responsibly, they don't think about the possibility that they can use it safely and responsibly. And the fact is the majority of people who use any drug do not develop problems with their use. And this is one of the arguments why harm reduction, taking a non-judgmental approach, is the one that saves the most lives and prevents not only the most deaths, but also descent into problematic use.
We are not here today to tell anybody how to live their adult life. We are not here to say that drug use is good or that drug use is bad. We are here to say that everybody deserves to wake up in the morning, and we can all do our part to make sure that our communities are staying safe from accidental fentanyl overdoses.
Thank you both so much. And I would be remiss in not thanking you both for sharing your expertise with us today. This past hour has been so educational, and I know I speak for everyone on this panel when I say I'm very grateful for it. Just to kind of finish off, I would just like to note that this session was recorded, and you'll receive an update via email once the files are available, and be able to access recordings free of cost on the websites of the National Fentanyl Awareness Day and also Song for Charlie in the future. We do encourage everyone joining us today to stay tuned for additional resources, updates, and a survey for your feedback. Thank you for joining us. Thank you for everyone involved in organizing this, and don't forget to spread the word and awareness about fentanyl today.
Thanks, Ava.
Thanks so much, Ava. Thanks, Emanuel. And thank you all for being here.